Good morning, doctors. Welcome again. Today we are going to discuss about osteoarthritis. This is a chronic, progressive, non-inflammatory, idiopathic, degenerative joint disease, which is related to aging process. With age, if osteoarthritis occurs, this is called as primary osteoarthritis. And secondaries are other arthropathies can predispose to osteoarthritis, such as overweight, and weight is a common cause of secondary osteoarthritis. Most common affects the joint of hands as well as the weight bearing joints like knee and hip joint. In India, the knee joint is most commonly involved in osteoarthritis. Remember the slice formula. S represents systemic. No primary osteoarthritis is not associated with any systemic symptoms, but secondary is yes. Now location. Location is hand, wrist, MCP, PIP, DIP, weight bearing joints, knee and hip. And I represent here inflamed. Joints are not inflamed here. And in slide C represent is chronic and progressive, worsen with activity and improves with rest, pain. Evidence of trauma may occur secondary to trauma specific joint, but primary osteoarthritis not associated with trauma. Now, history and symptoms like joint pain, age above 50, patient is obese, repetitive joint work, arthropathies, and diagnosis of osteoarthritis is by the help of X-ray of affected joints, reduction in joint space we see on X-ray. In laboratories, levels are normal here, and involvement of DIP joints called Hiberden nodes, and PIP is known as Bouchard's node. Treatment for osteoarthritis, patients suffering from pain, so painkiller NSAIDs is a drug of choice. Ibuprofen, ketoprofen, meloxicam, diclofenac, celecoxib are the drugs we are going to treat the osteoarthritis with the help of these. And acetaminophen is a treatment of choice, or we can say drug of choice. This is paracetamol is a drug of choice in this condition. Or we can give a hot and cold compresses. Exercise and physical therapy is indicated here, physiotherapy we can say. So hope about the osteoarthritis is very much clear for you. If you have any queries, any question, you can ask me, and if you still not subscribe my channel, please subscribe it. Thank you, good day and goodbye.